questions, we have next Nanne Isokuortti from University of Helsinki, and she is a doctoral researcher in social work at the Faculty of Social Sciences, and she is interested in implementation of evidence-informed practices in children's social services. So this is going to be a case of some work she's been doing in the research group, and I'll just give the floor to Nanne. This is a recorded presentation.
Hi everybody, great to be involved in this final PESP symposium. My name is Nanne Isokuortti and I'm a social work doctoral student at the University of Helsinki. Before I joined academia, I worked both in social work practice and also in social and healthcare administration. And today, based on my PhD, I'm going to talk about complex implementation in public services by using a case example from child protection. Next, I would like to share you my slides. All right. So this presentation involves three learning objectives. First, I would like to illustrate complex implementation with this real-world case example. Second, introduce you a widely used framework designed to guide and study implementation in a public service sector. And third, my aim is to provide some practical implications how to aid implementation in complex settings in the future. So I will start by presenting the case example, the systemic practice model, which comprises a new way of working for children's social services. And the model combines systemic family therapy with social work practice. And it consists of three interrelated core components that are shown in this figure. And in short, the model involves a multi-professional team which consists of social workers, a consultant social worker, a family therapist, and a unit coordinator. And this team holds weekly team meetings where the practitioners mutually reflect the family's cases and together find ways to help them. And the social workers are also trained to use thinking and tools from family therapy in their own practice. And this model originates in the UK, where it has achieved promising results based on the previous evaluations. And in 2017 and 18, this model was implemented nationwide in Finland in 31 agencies situated in 14 counties around the country. And the National Institute for Health and Welfare, DHL, supported the implementation by, for example, providing materials concerning this model and also organizing trainers' training and workshops for agency managers and leaders. And the Ministry of Social Affairs and Health, they funded the implementation project and, for example, the training, but the agencies located in different municipalities were responsible of conducting the service changes and recruitments for these new team members. And based on my and Elina Altio's mixed methods evaluations on the initial implementation, and the data was collected in 23 implementation sites, we found that the delivery of the model varied a lot. And the agencies also experienced many challenges during the implementation. For example, the practitioners were unclear on what the systemic social work practice actually is in their own work, their own practice with families. They were also disappointed with their training and experienced high caseloads, which prevented using these new skills in practice with all families involved in the services. And subsequently, many of them felt that they did not receive enough support from their agency leaders. But despite of these obstacles, the practitioners were satisfied to the model itself, as well as to the practical coaching they received, especially from the family therapists who were involved in their own team. And my forthcoming study focuses on a bit different level. Namely, it focuses on service managers, trainers, and these government officials' perspective of this initial implementation. And I'm currently preparing this analysis and particularly interested in the relationships between these different stakeholders and also the perceptions of the overall implementation environment in Finland. Now moving on to presenting that framework, I find this exploration, preparation, implementation and sustainment EPIS framework particularly suitable for assessing these kinds of complex implementation processes. And the framework introduces 4 phases that outline the implementation process. The first phase invites implementers to explore potential interventions that aid in solving identified problems in that organization or setting. Then second, the implementers need to plan the implementation process and support, including potential recruitments, plan concrete changes in service provision and training. And the third phase involves carrying out these supports and changes in practice, as well as learning new way of working to achieve change. And finally, this change needs to be sustained over time. The framework also involves 4 interconnected factors, which I will describe in brief in the following figure. So here, the outer circle refers to those 4 phases from exploration to sustainment. And each of those phases may involve different factors outlined inside the circle. So these outer context factors, they may refer to those kinds of extra organizational factors, such as sociopolitical context, funding, and inter-organizational relationships between different entities. In turn, the inner context refers to, for example, like intra-organizational factors, for example, that can include leadership, but also organizational and individual implementer characteristics, just to name a few examples. And between these two factors, there are these bridging factors, such as community, academic partnerships, and other intermediate stakeholders. And lastly, it should be noted that these innovations themselves involve specific characteristics which may shape the implementation process itself. So now I would like to return to the case example I presented to you earlier and illustrate some of the complexities embedded in the implementation of that SPM by using the concepts from that EPIS framework. So first, just to give an example of those innovation factors, as mentioned before, the SPM is a complex intervention with multiple interconnected components. And it is also not manualized. And although we researchers initiated a workshop process with the model developers and trainers after the initial implementation period to describe the core components and change mechanisms in theory. The model allows free adaptation in practice. Second, implementing innovations within a public sector is a challenge in the best of circumstances. And especially children's social care involves some special challenges that are likely to increase this complexity. And in the EPIS framework, this would refer to the outer context. And for example, child protection or children's social care, it serves families who have highly complex life situations and multiple simultaneous problems, which creates challenges to, for example, exploring suitable interventions or innovations. And thus far, there is comparatively little experience on implementing these evidence-based or evidence-informed practices in social service context in general. And it should be noted that children's social services is a publicly funded sector, and therefore it's sensitive to social and political forces. And this shapes what's being implemented and also what kind of resources. And many of these complexities are also reflected in the terms of the inner context. For example, the sector sometimes involves these intra-organizational structures and cultures that may not invite in active and collaborative learning nor the uptake of research in practice. And the practitioners and leaders also constantly operate with limited resources, have high workload, and the organizations also suffer from high staff turnover that has been observed in previous reports. And third, the implementation process of the SPM involved multiple stakeholders who had different kinds of roles in the process. So not only was the project led and coordinated by 2 governmental stakeholders, but also the social service agencies around the country collaborated with the government officials, as well as in some cases with each other. And the agencies themselves also involved a number of participants, such as leaders, trainers, and practitioners, who all had different kinds of interrelationships. And these characteristics illustrate both inner and outer context factors and those complex linkages between those two. I would like to conclude my presentation with some ideas how we could aid implementation in complex settings such as children's social care and other public service sectors. First, the saying "well begun is half done" applies, I argue, to implementation in complex environments. Oftentimes there is pressure to execute these implementation efforts and achieve results with new innovations within a relatively short time period. However, we know from previous research that successful implementation requires time and very careful planning. A detailed implementation strategy goes a long way, and different kinds of frameworks such as this EPIS framework can be used in planning because it takes account different implementation phases and different kinds of supports needed in each of those phases. And when designing this kind of implementation strategy, it's important to acknowledge potential barriers in advance and construct a concrete plan how to tackle those challenges during the implementation. And luckily, implementation researchers have developed organizational readiness assessment tools which can help in this identification task. And these kinds of tools and measures, they ought to be translated and made available for leaders in different settings. Moreover, supporting leaders who hold major responsibility of these implementation efforts with, for example, research-informed coaching packages, that would be very important. Currently, some international implementation organizations provide free materials to implementers that can be used in aiding the implementation. For example, Center for Implementation provides currently a free online mini course called Inspiring Change, which provides an introduction to implementation science and how it could be used in practice to help these change efforts. And finally, related to all these 3 points, I maintain that enhancing academic practice partnerships would support future implementation initiatives in many ways. For example, collaboration could involve guiding and adoption of promising innovation and interventions, planning and supporting implementation with fidelity, so deliver them as they are planned, and conducting high quality evaluations to monitor the process. And moreover, I think that joint forces might help in convincing policymakers to secure funding for future projects and inform them about the different supports needed in these processes. All right, so thank you so much for listening. I hope that this presentation have provided you some insights of the complexities embedded in implementation processes in these kinds of settings, but also some ideas how to respond to the related challenges. And I very much look forward to your questions and comments. Especially, I would love to hear if there are any policy or practice stakeholders listening, how these thoughts and ideas resonate to you, and what has helped you in implementation efforts in different sectors. So thank you again for organizers and all the participants.
Hey, Nanne, thank you for your talk. We don't have questions that I'm seeing yet.
I can start with kind of a question and comment, because yesterday Mr. Olli-Pekka Heinonen, who has been working as a member of parliament and minister and then as a civil servant, he said that one of his disappointments was implementation of a carefully planned strategy or program. I forgot what it was, but basically a very small part of the program was finally implemented, and we have, of course, this in many different sectors, but basically what he was kind of also suggesting, that involving the implementers from very early on in planning, like so that also the programs and the strategies would be planned from early on with implementation in mind, and also involving those who are on the ground then going to do this, that they would be very early on in the process. Did you hear that presentation? Unfortunately,
I did not, okay. But that sounds quite usual. So not very rare that these kinds of obstacles happen. And I need to definitely return to yesterday's presentations later. I have very much enjoyed the ones today, and I think there were very different kinds of interesting topics yesterday. So I need to return them. But just to add to that, I think yes, definitely, like early preparations are vital, and also including those people who are actually implementing that program or what was in that case. So that program and those in that that time already kind of identifying those potential challenges. So I'm wondering why they did not. So was the case that they implemented only part of the program, or ceased implementing it, or so just to identify those different kinds of barriers that were involved in that process, and maybe if they would have included those implementers in advance or very early stage, they might have been able to identify those potential like forthcoming barriers, and maybe find ways like strategies to kind of prevent them. Of course, we cannot prevent all kinds of obstacles that may happen in human service organizations or any human life, but definitely like preparing is the key. I see there's something in Q&A. I wonder.
Questions or
yeah.
Comment. I can read Natasha Tonger's comment out loud. I'm a clinical psychologist in a large healthcare system, and so I appreciate this perspective and talk. One issue I've observed is that large systems as stakeholders ironically don't seem to like or appreciate complex solutions to complex problems. So this is kind of a comment, not a
yeah. I think this we see it in different sectors, probably not only in psychology, but elsewhere as well. There's something else.
Pirjo Juvonen-Postis comment. How did you create the implementation guidelines, and how successfully you could implement them?
Pirjo, when you mentioned guidelines, do you refer to the suggestions I presented in the end of the presentation, or some other, like related to the model? Well, I could maybe Pirjo might. Okay, there you are. So
thank you, Nanne. Yeah, thank you, Nanne. It was really interesting to listen to your presentation, because it's the context you are talking about is, as you describe, in a constant changing of the system and the situation of the persons you are serving. And that's why I was really interested of that you mentioned the implementation guidelines for organizations. Did you use that? And if you did, how did you get it together, and how successfully you implemented it? What was the feedback from the organization of that? Because I have found that in the context of work-related rehabilitation that it is not easy.
Oh, definitely, it's not easy. And actually, this support to leaders, it was something that did not occur. There were no specific guidelines to these leaders and managers, and that hindered the implementation. So, and when I interviewed the managers, I'm currently preparing this analysis, and leaders, so they kind of felt they were quite distant from that change effort. So therefore I concluded that it should be vital to support leaders. Leaders should not be left alone in this major. It's always easy to say that because of the leadership, we could not do this and this, but definitely we should also consider supporting them in leading these processes. So no, there were no unfortunately, there were no specific guidelines, but I definitely think that there should be some in the future if disseminating this model or any other programs. And they have found good results from the UK, where they did have intensive ongoing support to leaders throughout the process and even in the preparation phase. So they the implementers there urged the leaders to think about their whole organization, how that organization needs to change when they are adapting this new approach. Although it happens in front line, but it needs to, because it's at best it's the kind of system change, and that new orientation is embedded not only in practice but also in leadership. So they have very good results on that, and I wish that we can see that kind of development here in Finland in the future. Hopefully this responded to at least some of your questions.
Thank you. I think that the message to take home is that you have to have resources for that kind of implementation work also in the research programs. So that what you described is not, it is time and resource taking task.
Indeed, and it's challenging in all kinds of circumstances, and needs support to different implementers in different phases throughout the process.
Thank you, Nanne. I think your presentation was really nice in showing the complexities of implementing a complex program in complex settings. So implementation programs are complex programs. So
indeed, and the implementation itself is definitely not a linear process, although we tend to see that just like we have this program and we put it into practice, but definitely not that kind of, although I presented those different phases, but they might not happen, they overlap and they are complex. So
yes. But we discussed this yesterday, that for simplicity and clarity, we just have to sometimes
indeed
draw it like this.
Indeed.